Today marks 421 days since our first case, going back to March 19th of COVID-19. Hard to believe we're 61 weeks later, and we're getting through this though, and getting through this together in a partnership. Since the outbreak started, we've lost 376 people to COVID-19, and again, my condolences and prayers go out to the family. Difficult time, but thank goodness no one else has passed away in the last couple days. It was National Nurse Week, so I had the opportunity to go to Colony Center yesterday with Paul Mahan, Senator Breslin, John McDonald, Pat Fahey, and and really highlight nurses not just here in Albany County but across this great country of ours, and to thank them what they do day in, day out as May 6th. And I did say every day should be Nurse Day, because unfortunately when we couldn't get into hospitals, they're the ones with our loved ones when they were at their sickest point, and when they passed away. So again, to these nurses that became a fabric of our community, and to families, extended families, thank you for what you do day in and day out. I also want to recognize those who serve in the county health department. We couldn't have responded to COVID as well without you, and all the nurses down there. Thank you for what you're doing and continue to do day in, day out. As of yesterday, 55.3% of Albany County's population has received at least the first dose of the vaccine. 44.4% has been fully vaccinated, which is good. Among those, at least 18 years of age in Albany County, this is great. We're actually 66.5% for our first dose of vaccine, the age of 18, which is, again, that when we talked about this, and Dr. Whalen and I have talked about it, and we used to bring out the smart board and show you that age group was the most alarming to me out of all of them, because it was spreading the most amongst it. We were correct, and it's good that they're stepping up and getting the vaccine. We know it doesn't affect them like it does older adults or people with underlying health conditions, but it's good that they're getting the vaccine to move forward. The statewide first dose vaccine rate is now 47.5%, and fully vaccinated rate is 37%, which is all good stuff, moving in the right direction. So again, doing this in a partnership to get it out is the best way of doing it. And I say to everyone, please educate yourself. Go online, read everything. I know there's some false information out there. Go to a trusted website, go to a trusted media site, and educate, because we need more and more kids to get vaccinated. And if schools, and I say this to the parents and to all the sports coaches out there, and I said it before, please educate your players, get them vaccinated, because we can get back to some type of normalcy in the fall for the kids, and and they don't miss graduations and proms and everything else. And I'm glad that we're having high school graduations this year. I have not heard anything about proms, but again, it might be another season without the proms going on. Albany County alone has now administered just over 37,500 doses at the Times Union Center and the Capitol Center. So to Dr. Whalen and her team, thank you. Again, it's a lot of logistics and a lot of things people don't see go on, and a lot of support staff that make things happen. And so I always say it's like our foundation in county government, just like my staff in my office. You can't do successful things without the people around you. So again, to the health department, thank you. Albany County hosted a first and second dose clinic at the Capitol Center on Wednesday. There were 847 people that came for the second dose, and then the first dose shots on May 5th, 48. We had 12 walk-ins, so the second dose shots will on May 6th, 1 to 2:30. But again, we're seeing that number go down, and we're going to be readjusting, and that's why we did partnerships with a variety of other people, because we're seeing less and less people get it. So please do your job, roll up your sleeves, vaccinate, don't hesitate, and we're going to get through this. And again, the walkthroughs were incredible, that people are doing a lot of the walk-ins. We also did some vaccination and education outreach through LaSalle School for Boys, Northern Rivers, in a partnership with CDPHP, which we announced, which has been going forward great. We had another second dose clinic at the Albany Capitol Center yesterday, which I talked about, where there are 1,230 second shots were administered, so which is good. In order to bring greater awareness to the safety and effectiveness of the vaccine, we'll be running our third PSA commercial starting tomorrow over the next 3 weeks. I want to say thank you to everyone involved, from the filmmaker, Adam, to those who were featured in the video, Pastor David Tram, the Reverend Dr. Jones Booth, and Central Med CEO Dr. Lombardi, and Sienna President Chris Gibson. So thank you for participating in this and helping us continue to get the message out there. Let's roll the video.
Our community has been tested. We've lost opportunities. We've missed milestones and celebrations.
We've held vigil in too many hospitals. We prayed at too many funerals. That changes now.
The COVID-19 vaccine is safe. It works.
It's how we move forward. In our community, we protect each other.
That's why
I've been vaccinated.
That's why I've been vaccinated.
So again, thank you, because there's still a lot of people that are on the fence. There's still a lot of reasons we need to continue to educate and get the PSA commercials out and to reach out through our community, especially the zip codes that Dr. Well and I have identified, and we continue to push and try to reinvent or reimagine how we get these vaccines out. And we're looking at every opportunity. So everyone that participates and gives us an idea, great. I want to say Melissa Jeffers from the town of Colony Town Board sent us an email, and she says Colony has farmers markets. Why can't you come here and do vaccine during the farmers market? Which, again, these are just great ideas to say, all right, we have to try things differently to make it work going out. So again, please, if you have an idea or you have something that you think we can do better, we don't mind criticism, because as long as it helps and it's positive and we can move forward, that's what it's about, moving forward together. So please. Additionally, I want to say to the Department of Health, 175 Green Street, which is where the old DMV was, now it's the BOE's there, Board of Elections. It used to be motor vehicles. You can walk up 9 to 3. Thank you to Dr. Whalen and her team. No appointments necessary. You can get the vaccine. That's going to be extended. So we still have that going on. And to anyone who needs transportation over the age of 60, our Department of Aging, we're going to make it work for you and your aide to come. We will pick you up. We will get you there. So that number is 518-447-7198. And you got to call in advance, obviously, and just give her some time, because it takes logistics and to work it out where we can pick you up, get you there, and get you home. We're doing everything we can. We've been doing home stuff for a while. I know everyone's been participating, trying to help out, from all Gilliland, Colony EMS, to the Sheriff's Department, to everyone that's been doing it. Again, everybody working together. We're almost there. The light's at the end of the tunnel. I know the governor's announced some good initiatives that we're starting to open up at 100%, is where we want to be for restaurants and for everything else to go forward. So as we continue and be hopeful that the Pfizer vaccine will be approved by the FDA next week for 12 to 15-year-olds, I got to say to the parents, please educate yourselves. Please look at the effects, look at the studies, and help us get schools back to normal, because this is the only way daycares this summer, or day camps, whatever they call them now, day camps this summer will be running at 100% is if kids are getting vaccinated. We'll get back to school, and like I said, we won't need this. We won't need the mask once we get to 70% and start to move forward. So please do your job. Talk to everyone. Parents, again, please take your time. If I have to, I'll give you Dr. Whalen's personal cell number. You can call her and get I'm sorry.
I think everybody has my personal cell number already.
And and get the answers to question. Take the time, talk to your doctor, and please help us do it, and we'll get there. Some of the good things are our Shaker Place nursing home. I really don't like. I wish I had some wood to knock on. We've been open for a couple weeks for visitors. It's been unbelievable for the residents that had such a tough year. But some of the good stuff is that our residents that are there have not tested COVID-19 positive since last summer, which is awesome. And our workers, it was about 4 weeks ago, that's why we could open up to start moving forward. So again, to the team up there that does extraordinary work with our residents in that facility, thank you. I kind of just we were getting questions on that, and I didn't want to Not that I believe in bad karma, but I didn't want to talk about it because things are going really well at our nursing home. So again, to the families that have loved ones that reconnected, it's I can't even begin to tell you what it's like when you see the families instead of the window visits, embracing each other. If you're not a compassionate person and don't cry, then you're never going to cry because it's very emotional. As of today, there's been 23,973 cases of COVID-19, 23 positive cases since yesterday, which number is good. Over the last 5 days, there's been an average of 19.2, which is good, and yesterday it was 18.6. So, a little bit up in that trend. Over the new positive cases, we know 4 had close contact with a positive person, 17 don't have a clear source, 2 are healthcare workers, 0 reported traveling out of state, and 17 without a clear source of infection at this time. So Albany County's 7-day average for percent positive rate is now down to 1.2%. The capital region's at 1.3, which is good. We're down below for its 7-day average, which is all good stuff. So there are now 209 active cases in Albany County, 522 people under mandatory quarantine, and there was 541 yesterday. 23 recoveries since yesterday, which we have a low number, which is good. 2 new hospitalizations overnight. There are now 26 people currently hospitalized from the virus. Yesterday it was 27. 10 patients in our ICU. It was 9 yesterday, and 3 days ago it was 6. So that number is just a little bit alarming to us. It's going in the wrong direction. But hopefully the hospitalizations continue to go down, but especially the ICUs. We don't like to see that number where it's at today. We continue to urge people to please wear a mask, socially distance, cough and sneeze into your arm, clean your hands, stay 6 feet apart. We'll get through this. And please, of course, if we need people to sign up to get the vaccine. We need you. I know it sounds like a broken record. Please, we need you to do the right thing. Dr. Whalen.
Good morning. So, yes, we continue to work very hard at the health department to promote education around the vaccine. And we've been very heartened by the people that have been coming down to see us at the health department to come in for walk-ins. We are going to continue to make this available on a daily basis as the health department is open from 9 to 3 p.m. So members of the public should be aware. Our location is on Green Street. We are 175. If you come down South Pearl, you can park in the old DMV parking lot and come down and be vaccinated anytime between 9 and 3 p.m. on weekdays. Our staff is there and willing and able to also answer questions. So if you're not sure and you want to speak to a public health educator, please present during those times and we'll have somebody come down and just give you the information that you need to make an informed decision. It's very important that people educate themselves with the facts. The facts are what we know from the studies that have been done, the evidence that has come out, and everything so far is very reassuring in terms of the safety and the efficacy of the Pfizer and the Moderna vaccine. And we know the J&J has been brought back into circulation. We are not currently offering J&J at the health department, but probably will be in the next couple of weeks. As the county executive indicated, we have received word from the state health department and other partners, and it's in the popular press as well, that there is a likelihood that next week the FDA will give the okay for the 12 to 15 group. So we spent some time this week preparing for that, and we have shared communications with all the school districts and with all of our local pediatricians. With our pediatricians, we have encouraged them to become certified vaccinators. We know that a lot of parents will feel comfortable for their children to be vaccinated within the confines of their pediatric offices. In order to do that, the providers need to become permitted through the New York State Department of Health. Not all of our pediatric providers currently have this designation, and we know it's unlikely that all of them will. So we also asked the providers to consider assisting us, coming down to our pods. At this point, we are provisionally planning that our pod next Thursday at the TU will be focused on the 12 to 15 group. And for that reason, we did send word to the schools that this is likely to go ahead, and that we want to reassure parents that at all of our pods, we have pediatricians and family practitioners who are there along with our nurses, along with public health educators. So people can come in, people can walk in, and as soon as we get the word that this authorization has come through, we will release broadly a link, like we usually do, for parents to sign up. We will be sending that out to the schools as well, so that they can push that through to their families and people can sign up for appointments. We really look forward to that effort. There are so many reasons to get your vaccine. We know, for example, this for the past couple of weeks, nationally, 22% of the cases of COVID that have been reported have been in the pediatric age group. So we really want to make sure that we can focus on this group as well. We know that, you know, young people, teenagers, like to be out and about a lot. They like to play sports. They like to be with their friends. And this is, you know, a way to moving them forward into normalcy to get back to the activities that they care about. Similarly, with teens and young adults, we know that, you know, the graduation season and the prom seasons are coming upon us. And the likelihood is that, you know, there'll be recommendations for, there are recommendations for those type of gatherings for testing in advance. And it's, you know, it's easier to be able to get the vaccine so that you won't have to get these multiple tests for different functions as we evolve into the summer season. People really, we wait long, and it's a difficult process for all of us in the Northeast to wait for the spring and the summer, and when it comes, we want to be able to enjoy it. So this is really the way that you can ensure the safety of yourself and your family to get back to normal activities. I do want to mention that the collaboration with CDPHP has been productive so far. We are going to be having pop-up pods at the focus churches for the next 3 Fridays. So we are conducting education on the Wednesdays before that to let people know that that is going to be available for people within the neighborhood. So please share that information. And if you are somebody who has been vaccinated, I will ask you to please share the reasons you've become vaccinated with your family and friends. We really need multiple efforts for education. So it is from our offices here at the county. It is the help of our hospital providers and our healthcare providers, but we also know the importance of community leaders and communities that you know, really trust many community-based organizations that we've been so lucky to partner with, like Capital District Latinos and others. These groups are really necessary for the effort to move forward. So that filters right down to the individual. So if you have been vaccinated, please share that story with people that you know and that you care about. Share your reasons. There are so many good reasons to be vaccinated, to protect yourselves and your families, and we hope that we continue to see walk-ins at our clinics and walk-ins at the health department going forward. We look forward to seeing you, we look forward to serving you, and we look forward to speaking with you.
Thank you, Dr. Whalen, as always, and thank you. So just change gears a little bit. I want to talk a little bit about the landlords continue to struggle to make ends meet. They're having a hard time because people aren't paying the rent, and we filed for money that was put out by the federal government back in January. We received $9 million, and I was waiting for ODADA, Mike Heim, the commissioner, to give us guidance on how to get that money to landlords. And I said this before, a little frustrated at the time that the state, instead of giving us guidelines, figured out how we had to give the money back. So In order to receive the other $600 million or more in upstate New York, we had to turn our $9 million over to the state, and our Department of Social Services did a good job, and my staff receiving that money. We had to wire it back to the state by April 27th, or landlords weren't entitled to any of the other money the state was holding on to. So they figured out how to take our money back out of the county. But what they haven't figured out is how the money's getting out. So I heard they're going to have their website up and running by May 23rd, so landlords can apply for this money. But the state's been sitting on almost $1 billion since January that needs to get out in the hands of people somewhere in that neighborhood. I know it's over $800 million. So good job, and hopefully they figure it out by May 23rd. But we just needed guidance to get it out. But again, we'll be patiently waiting, because I have landlords that call me all the time, text me, wondering where this money's at. So please call ODADA, and they should explain to you where it's at. On a different note, I want to make an important announcement today. This is Children's Mental Health Awareness Week, and May is Missing Children Awareness Month. So last month was also Sexual Assault Awareness Month, and after the horrifying, disturbing scandal that came to light with the U.S. Olympics, and from that doctor, and I don't even want to mention his name, our Crime Victim Sexual Violence Center developed a program that helps educate children and youth in sexual abuse and sexual violence. So by educating them on what is important and what's appropriate, and what is not appropriate, and and to better protect themselves, and being able to know what's acceptable behavior and what's not acceptable behavior. So by now we're expanding this kind of policy to all of our AAU sports here in Albany County. So any AAU sports that we sanction, we run through our Department of Recreation through Commissioner D'Antonio, and anyone that partners in with Albany County will now have to use this new initiative, and we're calling Athletes or Children First. So Athletes or Children First, and what's going to happen is our Crime Victim Sexual Assault Center is going to educate all coaches and county staff and children on youth on sexual abuse. So it's going to be the first of the kind, I believe, in the state, or that we're going to educate the coaches, educate any parents involved, and especially the children, so they know what's appropriate, what's not appropriate, and again, and knowing what they can do to go to the great resources that we have in crime victims. And and it goes for all of our sports: lacrosse, football, you name it, whatever we do, from our fishing club to our running club. It's going to involve everything, and when we open up in the Lawson's Lake again this summer, to bring children out there through the Boys and Girls Club in a partnership with Sheriff Apple and his team and my team. They're going to have to get trained on all this. So, but who better to talk about this great initiative? And I do want to say to Karen Ziegler and her team, thank you, because it's so important, especially after the year we've had, the 61 weeks of reporting of child sexual abuse going down because kids weren't in the classroom. Mandatory reporters, and I've said this, teachers who are on the front lines too, that see this day in, day out, weren't there to report neglect or child abuse for these children. And I think it's so important now, what has happened with the USA Olympics, that we not only just take ownership, but we change the culture. But Karen, please.
Thank you. Thank you so much. We are honored to be part of this conversation today. Almost a year ago, we talked to you about this initiative that the New York Society of Prevention of Cruelty to Children has initiated, the Athletes Are Children First. And we were thrilled to sign on as one of the a number of different agencies in New York that are going to be working with gymnastics clubs. Well, with the county executives and the legislators' support, we're expanding that. So not just gymnastics clubs, but any sanctioned sport. So we're going to be working with all of the athletic clubs that are that come through the Rec Bureau. Thank you, Commissioner D'Antonio, for that support, as well as the summer programs that his staff run at Lawson Lake. So we will be happy to work with every club, dance clubs, dance studios, basketball teams, karate dojos, you name it. We want to work with you because we think it's important. We want to teach children what's appropriate and what's not appropriate, but even more important, we want to work with those adults that are in the children's lives to help protect those children. So the coaches that have such a special relationship, dance teachers, karate teachers, those are the adults that children trust, that are in their lives on a daily basis. We want to work with them and train them on how to identify and how to prevent child abuse. It's so important that we protect our children, that we keep them safe. Children can't protect themselves against an adult. That's our job. That's where we come together as a community and we protect our children. So they are our athletes, our children, and let's keep them safe. So thank you so much, and if you have an interest, please reach out to us and let us know. We would love to work with you very closely. We're going to train the coaches. We're going to train the children. We want to provide support and education for the parents because we think it's our job to make sure our kids are safe and that they have wonderful childhoods and grow up to be amazing adults.
Karen, what's the number they can call?
Please, 518-447-7100. We also have a hotline, a 24-hour hotline, which is 518-447-7716, and we have a chat feature. A lot of youth would prefer to text and not call. If you go to the county website, albanycounty.com/CVSVC, you'll see a bright red button. That's our chat feature. Click on that, and we have a counselor willing and able to talk to you. Thank you.
Karen, thank you. You're also been an inspiration through these tough times and have been even before this for your advocacy for everyone and standing by and helping people through their dark times in their life. So I can't thank you enough. And remember, this is athletes or children first. This is what it's about. And thank you for this initiative that we're going to get out. And it's, you know, we're there to make a difference in kids' lives, give them opportunities with sports, but give them that fundamental education and foundation to be good adults and know the difference between good and bad. So this is a step in the right direction. So again, thank you for everything that you're doing, and it's good policy. For those who want to get vaccinated, please, you can go to the state website or call their hotline, 1-833-697-4829. Or you can, again, you can just go to the website. United Way, thank you, as always, 211. Yes, Pete, I finally wore your mask that you gave me. I know you were getting on me about it, and I did have it, so I wore it today. 211, thank you for what they're doing, and to all the partners that we've had over these last 61 weeks. Albany County website, as always, to find out about getting COVID-19 testing, eligibility, and everything else, it's there. And our mental health support line is still available 7 days a week, 8 a.m. to 5 p.m. That number is 518-269-6634. Please, again, you know, I keep saying this. I got to get Dr. Giordano on here to talk about it. Our numbers are really going down with people calling in, but that's good. Again, people are reimagining and getting used to the new world pre-COVID and you know, and after COVID. So please, the light's at the end of the tunnel. Hopefully we have some type of normal summer coming upon us for the workers. And as always, please call the sexual assault hotline number, as Karen Ziegler just said, 24 hours a day, 518-447-7116. And I do want to say to all the mothers out there, happy Mother's Day for Sunday, especially to my mother-in-law, who's 110, and my mother's 90. I'm kidding. I know they keep getting on me. And to my wife, and to everyone that, you know, you might not be a mother, but you have raised somebody and you've been that inspiration, and it's your day too on Sunday. So happy Mother's Day to everyone. And again, we're getting through this together in a partnership. Stay safe out there and continue to wear your mask and get vaccinated. Any questions? No questions?
Can I just also say that it is National Nurses Week, so I would be remiss in not also mentioning the wonderful nurses that we have at the Albany County Department of Health who have really been instrumental in the vaccination effort, and also the nurses in our MRC. We have so many dedicated nurse volunteers that come and make the clinics the experience they are for everybody. So I particularly want to thank Deputy Commissioner Mary Beth Miller, who has been with the Health Department for many years, was formerly the nursing director, and now serves as Deputy Commissioner. She is my right-hand person, and I appreciate her more than words can say, and also Kathy D. Thomasis, who is our Director of Nursing. These wonderful women have really worked above and beyond the call of duty along with the rest of our nursing staff for the past year, and I just want to take a moment to say how much I appreciate them. Thank you.
Thank you, Dr. Wellen, and thank you, Karen, and thank you to everyone. Please be safe out there, do the right thing, and we're getting through this, and hopefully to a normal summer. Thank you.